Brilliant. Good afternoon, everybody, and welcome to the February edition of the SFMI Bitesize Webinars, where we aim to give you a pit stop guide through the experience and lens of the SFMI partners, using their wealth of experience to help you overcome challenges and pitfalls which you may not otherwise foresee. So today's webinar, we look at the important topic of health and well-being. And joining us today, we have Francesca. So I'll introduce Francesca in a second, but as always, I'll have a very quick run through about the SFMI for those who haven't heard of us before and this is your first webinar. So the SFMI is a kind of a purpose-driven product where we are driving to embed sustainability into the management and operations of the FM sector. We do this by a number of ways, by understanding the issues surrounding sustainability in FM, by providing a sustainability roadmap for organisations to follow and take assessments on to understand where they are and where they need to be going and what they need to be concentrated on next. We provide upskilling literature and webinar sessions and events to the sector as well, which this is one of those things. And also we celebrate and share success and excellence in the sector. So we're sharing best practice in today's webinar, but then also we will provide that within reports and thought leadership, and also share the success of companies who are performing well in our annual SFMI assessments. We see the FM as massively important in the role of sustainability, but not only environmental sustainability, but also social sustainability as well, because FM is a huge employer of people, and it has such a diverse range of individuals as well, so it can play a huge role in social mobility, but also health and well-being of individuals, and also managing buildings to ensure that people are looked after, but also are environmentally friendly as well, and achieving net zero goals and aims of organisations. So we're joined today by Fran Chinery from Skanska UK. Fran is the Senior Environmental Advisor for Skanska, and is also supporting several FM contracts as well, and also has also taken the company through the successful certification of their new building 51 Moorgate, which will play a key role in this particular webinar. So I'm going to hand over to Fran in a second. What we're going to do is, if you have any questions during the session, then please pop them into either the question tab or the comments tab, and then we'll filter those out at the end and have a discussion around them. If we don't have time for all of the questions, which sometimes happens, then also we'll forward them on to Fran, and she'll provide her feedback and comments after the event. So Fran, over to you. If you want to share your screen.
Thanks, Chris. Hopefully you can see that okay. Yeah. Brilliant. Thank you very much, Chris. Thanks for the introduction. Good afternoon, everyone. I hope everyone is well today. As Chris mentioned, I'm going to be doing a short webinar on healthy and green buildings and how this can impact the way that we deliver FM. So today I'm going to talk briefly about, sorry, just getting the agenda up. I'm going to start by talking briefly about healthy and green buildings and the importance of them. I'm going to touch briefly on the well building standard, and then look at the case study of 51 Moorgate, which is Skanska's offices. We're going to go into some detail about aspects of healthy and green buildings. And then lastly, we'll look at what the impact that is on us, lessons learned, and next steps. So what is the case for healthy and green buildings? Well, given that we spend 90% of our time indoors, so whether that be in the workplace and at home, clearly the buildings that we occupy have quite a big impact on our health and well-being. Yet typically the way that buildings have been designed, built and also operated can actually have quite a negative impact on our health and well-being. And this really highlights the need for us to focus on the health and well-being of building occupants first and foremost. Delving into a little bit more detail, when you consider the sick building syndrome, this is a condition in which building occupants can suffer symptoms as a result of the building they occupy. Symptoms can include headaches, dizziness, nausea, skin, eye, nose and throat irritation associated with indoor physical environment. Reasons for this could be, for example, indoor pollutants from cleaning products or the materials that we have in our buildings, which can then lead to occupants suffering from this. Staff costs typically take up 90% of business operational costs. So investing in healthy and green buildings will ultimately reduce these costs due to less staff sick days and improved productivity, and really highlighting the importance of that. But healthy and green buildings should aim to go beyond just the sick building syndrome, but should actually look to ensure that occupants are free of bad health and create environments in which they feel productive and engaged and satisfied in their workplace. So it really should holistically consider a wide range of aspects of health and well-being. So not just the standard ones such as air quality and water quality, but also mental health, nutrition and access to nature. And that's some of the things I'm going to be discussing in a couple of slides' time. COVID-19 has only compounded the need for businesses to prioritise the health and well-being of their own people. I think following the pandemic, we can all really see the value in that. There's lots of research that links our building environment with productivity. Research suggests that physical workplace is actually one of the top 3 factors that can affect our performance and job satisfaction. And also when you consider the amount of businesses that now offer flexible working policies, this really puts a demand on them to provide spaces that staff actually want to be in, to encourage them back to the office. Businesses that fail to do this will struggle to attract the right talent, but also to get the most out of the talent they have. This really relates to us as FM providers, as this is going to increase the demand from our clients to make business buildings enticing and change ultimately the way that we deliver FM. Lastly, when you look at the building performance gap, you consider the fact that buildings are typically commissioned, they're handed over, and they're rarely retuned to the current operations of the building and the needs of occupants. Therefore, what we often find is that buildings are actually typically operating in ways that are at odds with not only our health and well-being, but also with sustainability targets such as reducing energy and saving carbon. And with the amount of net zero carbon targets that our own companies are setting, as well as our clients, clearly the way that we operate buildings currently needs to evolve to achieve this. All of these reasons I've just mentioned there really highlights the need for us to invest in healthy and green buildings, and that will really affect the needs that our clients place on us in the way that we deliver FM. So the Well Building Standard is one way to deliver healthy and green buildings for our clients. It's the first building standard that focuses exclusively on health and well-being, and it links health and well-being with productivity. The standard combines best practice, but it's also backed up with evidence-based research as well. It's composed of over 100 features that are designed to address issues and impact health and wellness, from design through to operations and behaviour. There are 3 different certification types to cover all phases of design, construction and operation. So today, in today's webinar, I'm just going to be discussing the operational elements of healthy and green buildings and how this links with the delivery of FM. But it is worth noting that WELL isn't the only way for us to achieve healthy and green buildings. There's lots of other standards with similar aims, such as Fitwell, BREEAM in use and RESET. Or thermal certification, of course, isn't required. You can achieve a healthy and green building without that formal standard as well. But looking specifically at 51 Moorgate, so 51 Moorgate is Skanskas London office. We are our own client of 51 Moorgate. We developed it, we refurbished it, and now we look after it. So we occupy 3 floors out of 7. We were awarded WELL in June last year, and we were the first building in the UK to achieve WELL to the pilot version 2 standard. We decided to pursue it mainly for the health and well-being benefits of our own occupants, so our own staff, but also we really wanted an office that was different and that showcased our ability to our clients and demonstrated what we could help them achieve. We are increasingly seeing our clients want healthier and greener buildings, and so we wanted really an office that we could demonstrate how we could do this. Alongside last year we also implemented our smart building platform. So Skanska have been developing a smart platform and service, and there's real synergies with that and healthy and green buildings, as all of the sensor information that we require to deliver a healthy and green building feeds into the smart platform, which allows us to analyze that data and actually create actions as a result of it. So looking at healthy and green buildings, as I mentioned earlier, it really is a holistic view of health and well-being and really covers quite a wide range of areas, as you can see there. So I'm going to go into a little bit of detail by each of the aspects, how this impacts our health and well-being, and then talk specifically about what we've done at 51 Moorgate to address this. So starting with air. The impact of air quality can include headaches and nose and throat irritation, even through to more serious longer term issues such as asthma attacks and cancer. Common air contaminants can be from combustion sources, so heaters, candles, smoking, but also the materials that we have in our buildings, such as cleaning products and furniture, and also outdoor pollution as well. We can improve indoor air quality through behaviour change, through eliminating those pollutants, and also through filtering air. So at 51 Moorgate, we have to meet quite strict air quality thresholds. We also have over 40 sensors throughout the building. You can see a picture of one of those there, and they are continuously monitoring the air quality in the building. And this information is feeding into the smart platform for us to see what the air quality is like. We also have demand-driven ventilation, so we increase fresh air in the building when CO2 reaches a certain level. We've banned combustion sources, and we only use specific materials in the building, and we also filter air to purify it as well. Moving on to water, lack of water can lead to a range of issues. Also, poor water quality can lead to infectious diseases and cancer. But the treatment and distribution systems of water can also be a source of contaminants. Substances that we use to kill harmful pathogens in water can actually then lead to the development of harmful byproducts. We're also seeing increasing risk of water pollution from different sources. So all of those things combined really highlights the need for us to ensure that the water quality in the building is high. So in order for us to do that, again, we have to meet quite strict water quality thresholds in the building. We have regular water quality testing, and this ensures that the drinking water we have on site is of really high quality. And we display the results of the water quality test for our occupants to view, should they wish as well. And we ensure that we have lots of drinking water stations across the building to ensure that our occupants are hydrated. Moving on to nourishment, so poor nutrition can lead to a range of different issues and actually causes 3 million deaths worldwide. Most individuals don't consume enough fruit and veg, and most of our diets tend to be quite low in fruit and vegetables and whole grains, and high in refined and packaged foods and salt, sugar and fat. Improving nutrition would require both policy and environmental change, and these policies can include availability of healthy food choices on site, the sorts of food advertising and marketing that we use, and also just increasing nutritional knowledge for our occupants as well. So at 51 Moorgate, we have fruit and veg baskets across the building for our occupants. We limit oils and sugar and promote whole grain foods in the foods that we provide for our staff. In our kitchen areas, we have healthy nutritional messaging across the building, but particularly in those kitchen areas. And also we have access to healthy cookbooks across site as well, so that people can make more informed decisions. When we look at light, we have to consider the fact that the lighting environment can impact visual, circadian and mental health. Yet in most offices and buildings, lighting only considers the visual impact. Disruption of the circadian rhythm can have quite a big range of effects. Also, access to sunlight can as well. So we know that access to sunlight can affect our mood, it reduces symptoms of depression, and it increases productivity. So to address this at 51 Moorgate, we have a range of types of light and also levels of light to fit the varying needs in the building. So the lights in the office space and the workstations will be completely different to the lights in the breakout areas and wellbeing rooms. During the design phase, a daylight plan ensured that the layout of the office meant that there's sufficient natural daylight. So 70% of all our workstations must be within 40 meters of a window. We also have glazing, and all our glazing has shades to ensure that our occupants can control solar glare. And we even have additional lighting on hand should someone need it to meet the different needs of our occupants. And again, as with air, we have light sensors across the building that are measuring light levels to ensure that they are at the right threshold. When we look at movement, physical inactivity can impact us in many ways. Yet nearly a quarter of the population are physically inactive. When you also consider that 6 to 8 hours of sitting a day can increase the risk of mortality from all sorts of diseases, it's really important for us to try and encourage movement. Workplaces are typically designed to demand less movement though, so this is a challenge. So at 51 Moorgate, we have active workstations. So you can see in the picture there, we've got sit-stand desks, we've got balance boards, and we've even got exercise balls for our staff as well that they can use. We have enhanced bike storage facilities and shower rooms, regular yoga class, and we promote physical activity with gym membership discounts and educational materials as well. Thermal comfort is a really big impact of healthy and well-building buildings, in the sense that it's the highest contributing factor to human satisfaction. So it often comes up as the biggest issue in occupant surveys. It impacts energy use, health, and well-being and productivity. So employees tend to perform 6% poorer when the office is too hot and 4% when it's too cold. Yet we know that one size fits all approach won't work. This fails a lot of people because thermal comfort is subjective, and not everyone is going to be comfortable in the same conditions. So to try and tackle that, there's different things that we've done. We monitor thermal parameters. So we have sensors across the building that are measuring temperature and humidity, so we can track this. We have surveys to find out if our occupants are satisfied. We have thermostat controls in the meeting and wellbeing rooms to ensure that people can control the level. And we even have blankets as well, so that those people that are really cold can use those if they wish. Sound pollution. So sound pollution can impact us in a multitude of ways, including productivity, focus, memory, and mental arithmetic. And there's lots of sources of sound pollution in a building, typically from HVAC equipment, appliances, and also other occupants as well. The issues with sound in terms of reverberation times and background noise can also impede speech intelligibility and cause strain for occupants who may have hearing impairments. So it's really important for us to address that. And the way that we've done that is considering noise in the design stage. We've also got acoustic zones. So we've got quiet and well-being rooms where the noise levels will be much lower compared to the busy workstations, which obviously would have much higher noise levels. We have to meet sound thresholds throughout the building. We've implemented sound reducing elements such as furnishings, and we have sound sensors to measure the sound levels as well. With materials, when you think about building materials and products, they have a much longer use phase than other typical materials, and this makes their impact on indoor air quality quite significant. VOCs, legacy chemicals, and hazardous waste can all impact our health and well-being. VOCs are abundant, and they're a group of chemicals. They're abundant in indoor environments, and sources of them are insulation, paints, coatings, furniture, and flooring, for example. So in order for us to address this, we restrict the presence of harmful chemicals on site. So we don't have any pesticides on site, but also the materials that we use in the building have to meet certain specifications, like, for example, the paint that we use and the furniture that we have, and also our cleaning products are all non-hazardous as well, to reduce the impact there. Mind is obviously a key one. Mental health is not simply the absence of a mental health condition, but it's about an overall state of well-being in which we can live life to the fullest, we can cope with the normal stresses of life, and ultimately we can work productively. And the impact of stress and depression is far and wide. And when you consider that over 30% of adults will experience a mental health condition in their lifetime, clearly this will impact all of us in terms of business. The impact of it is profound. So depression and anxiety costs the global economy $1 trillion a year because of productivity loss. So it's really important for us to address that. Given the high prevalence of mental health conditions in the workforce, the workplace is increasingly being seen as important for mental health promotion and prevention. So we really do have a responsibility to address that. And the way that we've done that at 51 Moorgate is providing mental health support to all of our staff through our employee assistance programme. We also have access to nature around the building. So in some of the pictures you've seen on these slides, you can see the green wall that we have at 51 Moorgate. We also have plants around the building and a courtyard as well. We have mental health training for our staff. So we have mental health ambassadors and first aiders, and we have wellbeing rooms that we encourage our staff to go to if they need a break. And we also discourage people going there to work, because the point of it is to go there and have a break. And lastly, community. So we really do have the potential in the workplace to promote health and encourage healthy behaviour. And the impact of this is improved job satisfaction and well-being, and overall better health and reducing health risks. For organisations, so for our clients, the key benefits are lower absenteeism costs and improved productivity, but also improved culture and employee morale as well. So at 51 Moorgate, you'll see on the pictures you've seen on the slides, we have health and wellness education across the building. We also have Skanska Life Hub, which has a variety of resources online. I've mentioned the access to nature throughout the building, and through our environment policies as well. And I can say that 51 Moorgate, it really is a lovely building to work in, and I really think it does improve in staff morale for the people that are based there. So what is the actual impact of it? So we have analysed literature and publications around healthy and green buildings. We've estimated that at 51 Moorgate, we will annual savings will be £40,000 in absenteeism costs, £16,000 in staff retention, and we'll save £80,000 due to an increase in productivity. So obviously some real big savings for us there. I mean, it is definitely worth noting that these are estimations, they're not quantified savings, and we're currently looking to validate those. But clearly we can see the benefit of healthy and green buildings at 51 Moorgate. So lessons learned from the project. It was obviously, quite a difficult but enjoyable project. Some key lessons that we've learned from it, like everything, it was impacted by COVID-19. So the testing was delayed, and this meant that the project went on for much longer than we initially expected. Some of our test results were also impacted as a result of the low occupancy in the building. So our water quality results were impacted due to low usage. There were other features we weren't able to fulfill because of low occupancy, such as the surveys. So all of those things we had to manage alongside trying to get the standard, and that was a challenge at times. Another key thing that we really learned from it was managing change. So for the FM team on site, they had to adjust to the way that they delivered FM there. Clearly, there are a lot more requirements and consideration compared to traditional buildings. And so managing that change has been a real lesson. And also, quite surprisingly for some people, managing change for occupants as well. So for some occupants, suddenly occupying an office that has lots of health messaging across the building can be quite overwhelming, and they might be quite resistant to that. So managing the change on that side of things has been a real lesson as well. So what are the next steps? So if you're interested to find out more and you're not sure what the next step is, well, ultimately the next step would be to speak to your clients and find out whether this is something they've considered before. If they have, why, what is their aim, what do they want to get out of it? Is this something they want to invest in? You can also find out more about healthy and green buildings in lots of places. The UK Green Building Council have published several reports around it. There's lots of reports in industry research. JLL have recently released a report around it. So there's always movement around this subject in the industry. You can find out more about certifications such as WELL or BREEAM or FitWell. But remember that certification is not the only route to delivering healthy and green buildings. You can deliver it without that. And there are some quick wins that you can do in the way that we deliver FM for our clients. You could install sensors in the building to measure air quality. That's actually relatively easy, and you can get sensors for quite reasonably priced. You could increase the amount of plants and greenery in the office to improve well-being. You could switch to non-hazardous cleaning products. You could look to implement active workstations, or you could just even provide access to healthy resources for our clients, and all of that would make a huge difference. And that's it. So yeah, that was a real whistle-stop tour. I hope you guys found it interesting, and I would welcome any questions.
Thank you very much, Fran. That's great. I guess I will start off. I'll start the ball rolling on the questions. You mentioned about managing change within the FM team when it comes to managing the building like this. What can you delve into a little bit more detail about what kind of challenges the FM team would have come up against?
Yeah, definitely. So I think one of the key challenges is typically in the past with FM, health and well-being isn't really a key focus of it. And so there are lots of elements in the well building standard and also just in general that you have to consider that they wouldn't normally have had to consider. Like, for example, the sort of that even just down to the soap that we use on site has to be non-hazardous and vegan soap. And then also down to the food that we provide for our staff in the kitchens has to hit certain nutritional levels. So all of those different considerations they're suddenly having to consider alongside still running a building and doing that in the right way. So I think it's just opening their eyes to the benefits of it and ensuring they're considering everything has definitely been a key challenge.
Oh yeah, I mean, what kind of data flows are we talking that they have to manage as well? Is there any
data flows? Oh yeah, a huge amount. So luckily, because we implemented the smart platform at the same time, that has really aided us in doing it, because all of the sensor information we have is automatically sent to that platform and the data is then analysed. Without that, it would be a hugely time-consuming project to just oversee the data side of things.
I mean, is that a kind of a skill set that you had within the organization, or is it one that you've developed internally? Or
it's one that we've developed internally. So yeah, Skanska have developed a smart buildings platform, and 51 Moorgate being our own offices was the test bed for that. So we were quite lucky that the timing for that seemed to marry up quite well, that once we'd achieved well and then we had to actually start analysing and measuring data was around the time that they were looking to implement the smart platform, and that worked out really well for us. But without that, it would be a struggle because of the amount of data that you have to consider: air quality, water quality, and it is all continuous as well. So yeah, you're looking at a huge amount of data to analyse and measure.
Yeah. And on the other side, we've got a question that's come through about managing change on the occupiers side as well. You mentioned about some pushback or kind of apprehensions of it. Can you delve into that a little bit more and give us an understanding of how you've been influenced by or influenced the behaviour of the occupants? Yeah, so some of the intervention or some of the things that we implemented as part of the project, we just have to tread really carefully about the way you communicate that with staff, because we don't want to be seen to be interfering in people's lives and telling them how to live their life. And some of the things around in the breakout areas, the food and beverages that we provide have to meet the nutritional levels. So we can't provide certain cereals, for example, or certain condiments because of the high salt and sugar levels. And you just have to be really careful the way you promote that and frame it, because obviously, yeah, some people would just naturally be quite resistant to that and feel as if their workplace are interfering in their lives. So yeah, that's a good example. Yeah, I'm sure. How about so when you started off the project, you probably had an idea of what the priorities would be in terms of how a healthy and green building would look like. How did they change, or did you get surprised by anything which came up as you were going through this process to understand the depth of information that goes into this?
Yeah, so I think, so as I sort of said at the beginning, I think the typical ones like air quality, they don't really seem to surprise you, because you know that obviously that the link between that and productivity and health and-being is quite well known and clear. I think the elements around nutrition quite surprised me, and also mental health. I mean, obviously we know that mental health is an issue, but in terms of linking nutrition and mental health in the workplace was quite a surprise, because it's always something you wouldn't really link to your workplace. So I think those elements are the side of things that has surprised me the most in terms of how much we can actually influence our occupants' lives with the things that we can do on site. So those probably, yeah, so like light and sound and air quality seem like the obvious ones. It's movement and mental health and nutrition. Those are the ones that I find them more interesting, because they're a little bit more of a surprise when you think to a traditional building. Yeah.
I think finally, just to wrap up with this, I mean, in terms of Skanska's positioning of its FM team, are you positioning it in a guiding the clients on health and well-being? Is that kind of a string to the bow, or is it kind of, you know, what's the position of that when you're looking externally?
Yeah, absolutely. So we've delivered a lot of well projects across Europe and America. So 9% of all well certified space has actually been delivered by Skanska. So it's definitely something we see as a speciality of ours, and something that we can help our clients deliver. So yeah, it's something that we are trying to help our clients on that journey, but also we are finding more and more of our clients are asking us for that as well. So yeah, we definitely see this as something that will only be asked for more, and we will deliver more of.
Cool. Okay, thank you, Fran. That's what we have time for from you. I've got to wrap up the discussion now, while so people can either grab their lunches. Yeah, thank you very much, Fran. That's a great insight, and we will forward you on any unanswered questions that we haven't got round to. But thank you very much. So what comes next then? So next month in March, we have Arcus Facilities Management, who will be presenting on starting their sustainability journey in FM. So actually, it would be great to see from the perspective of an organisation who has come into the SFMI later in the game, should we say, and is working its way through that continuous year-on-year improvement. And so we'll be getting the thoughts from Catherine Ebury and the hints and tips of how businesses can be starting their journey. Also, keep an eye out for the upcoming year's schedule of bite-sized webinars. So this year we're going to be building up more of I think a story and a journey within the webinars. We'll be working our way from the strategic management through to the operational implementation, and also the value chain management as well. So we'll be trying to take you on a month by month journey, which allows you to kind of walk your way through the sustainability journey. So we'll be reaching out to our FM partners to see who wants to play a part in that coming up for the next year. Also, we have a report coming out at the end of this month, the long-awaited Sustainable Procurement in FM report. So please do keep an eye out for that. Also, if you haven't already seen it, then currently out and accepting feedback on is our Scope 3 emissions in the FM report, which was completed in just at the beginning of December, and we're currently working on the follow-on copy of that report as well. Also, if you're in town in London next week, please do say hello. I'll be speaking at the Workplace Futures Conference on the 22nd. So I'll be kicking off the Going Green section of that conference. So please do come and say hello. So thank you very much, everyone, for listening. Thank you very much, Fran, and the team at Skanska for delivering as well. And we look forward to seeing you next month. Thank you very much.
Thanks, everyone.